Welcome to Adventures in Surgical Weight Loss with Dr. R. I'm Dr. Richard Rasmussen. I'm a bariatric surgeon and excited to bring you another story from a surgical weight loss patient. My goal is to give patients a place where they can share their amazing stories. I get to hear these stories all the time. I hope through this process to get rid of some of the bad information that exists about surgical weight loss. Today we get to meet Laura Palmer. Laura has a wonderful experience and introduces us to a new topic we haven't addressed yet on this podcast, lipedema. She'll explain what that is and the treatment for it. I think you'll find it very educational. I also love the non-scale victories she shares, so I think you'll enjoy getting to know Laura. Today I have the opportunity of sitting down with Laura Palmer. Welcome, Laura.
Hi. Thanks for having me.
Glad to have you. Why don't you go ahead and tell us your story?
Well, I have in my adult years kind of always yo-yoed with my weight. In high school, I was an athlete, and so that, I was pretty fit then. But I always was super self-conscious about my legs, and I would work out really hard, and they would shrink, but not as much as I wanted them to. And then when I started my family and small children, my health wasn't a priority like it should have been. And my weight...
That's a lot of moms.
My weight just ballooned. And I tried a couple different things. I tried GLP-1s, and they worked. Like, I think I got down like 35 pounds, but then I plateaued with those. And one day I was on Instagram and I saw this woman on there, and she had the exact same body type that I had. And I was like, and she had a condition called lipedema. And I thought, if she has that condition, I definitely have it. And for those that don't know what it is, it's a connective tissue. Now I'm all tied over my words. It's an inflammatory disease of the connective tissue at the fatty layer. And to put it in plain speech, it means that you have fat that is very, very, very almost 100% resistant to diet and exercise. I went to my doctor and she said, you very well could have it, but you are overweight and you have other fat on you. So lose as much weight as possible and then come back and we'll talk about it and talk about the lipedema diagnosis. And I knew that I wasn't going to lose the weight on my own as fast as I wanted to. And I had tried for so many years anyway, and it hadn't worked. So I made an appointment with your office. And I actually went in hoping that you would be my surgeon. And then she put me with, because you had I had friends that had surgery with you and they couldn't say enough great things. And then she put me with Dr. Pierce and I was like, okay, we'll try this new guy. Anyway, I love him and I'm grateful that he was my surgeon and that we did the surgery awesome. That we did. So I can't say enough good things about him. So I went in, I had now he calls it the Sadies. You called it the Sadie S.
We've had a couple discussions before we started recording about tomato. Yes. Maybe I'll take a moment just to explain that. Okay. So it's spelled SADI-S. And so some people will call it Sadie, some people will call it Sadie S. What it stands for is single anastomosis duodenal ileostomy with sleeve. And so it's a newer weight loss operation. In fact, I interviewed him on this podcast, and he and I went through the different types of operations, and we talked in detail about what that operation is. But briefly, it's a sleeve gastrectomy, which is common for most people, but then you also take the small intestine and hook it up to the the first part of the small intestine after the stomach. So you go from what's called the duodenum, which is the first part after the stomach, to the ileum, which is the last part of the small intestine. So you end up bypassing a lot of small intestine. And so that causes some malabsorption as well, which is why it's kind of doubly effective. The sleeve causes some restriction, and then the bypass part of it creates some malabsorption. So brief explanation of ascites or ascites.
Yes, thank you. And as many times as you guys explain that to me, I don't know if I could re-explain it.
It's
I
all
just tell
right.
people it was a sleeve with some rerouting of my small intestine.
That's actually a better explanation anyway.
um, and I went in and I don't like it when people go into the doctor and try and tell the doctor how it's going to be. But I did go in pretty certain and pretty set on just a sleeve. And Sophia was like, no, we're going to go over all the options first. And so then when she started talking about that one, I was like, okay, tell me more. My mind can be changed. And it was. And then I talked to Dr. Pierce and I was like, I think this is the route that I want to go. So I got that surgery, and the weight started to come off pretty quickly. I had already lost, before I had the surgery, I had lost like 35, 40 pounds. And since surgery, which was not quite a year and a half ago, I've lost 80 pounds, 80 additional pounds. And so it's working
So
great.
120 pounds, that's awesome.
And I looked in the mirror though last summer, and I was like, my legs have not changed. They got smaller. Of course they got smaller because it wasn't all diseased fat in there, but they were still heavy and swollen, and people with lipedema, that's very painful, which I didn't realize. I just thought everyone's legs hurt. I didn't realize that wasn't normal. And so I went back to my primary care, and she said, I'm pretty sure you have it. But she said, I'm not an expert in it. I want you to go talk to somebody who is. And so I did that whole process and found a doctor here in Utah, and I've gone through all the treatment for that, and I'm like feeling so great. And I'm happy. Even if I didn't have that treatment, I've lost weight just with the weight loss surgery, and I'm so happy. But I think a lot of women they say 10% of women have lipedema, but I would guess that vast majority of them don't know and blame themselves, and they try all these different methods to lose weight, and nothing really changes. And it's hard. That's a hard pill to swallow, to try so hard and have things not work. So I have been talking with my lipedema surgeon, and I said, you really need to get in with these weight loss doctors because you guys have got to work together. I believe that you should lose as much weight as possible before you get any kind of surgery. If your knees are hurting and you're overweight, then you need to probably lose weight. I was having a lot of aches and pains that are gone now. They were gone, just a few months into surgery. And I had shied away from surgery because I just let the outside voices get in to tell me no, you can do it yourself. That's the easy way out. Well, it has not been easy. And I'm healthier. So why wouldn't I have just I don't know why I would have listened to those voices. I'm healthier now, and I'm happier, and it happened quickly. And I'm so much more active, and it's been so fun to I never let my weight stop me before. I would always do all the things. But what really got me I've got to do something was I went to SeaWorld with my kids, and SeaWorld San Diego has rides, and I couldn't ride all the rides. And I was like, okay, that's not the kind of mom I want to be. I want to be on those roller coasters with my kids. So last summer, we bought lagoon passes, and we went once a week at least. And I rode every roller coaster. And I'm like, okay, this is why I did it, is for those kind of things. And it's been really fun. And I was walking through Las Vegas in October, and you know how they have those like street performers. And there was these two muscle men, and they were like calling me over, and I went over. I'm like, yes. And then next thing I knew, they picked me up in the air, like high in the air, and I was like, take a picture, somebody take a picture, because I'm like, they would not have done that a year ago. They would not have called me over and been able to put me in the air. And so that was really fun for me. And my husband was just laughing, and he couldn't understand why I wanted a picture. But I said, because this is why I lost the weight, is so that two muscly men young enough to be my children could pick me up in the air. Anyway, that was a non-scale victory. And buying clothes off the rack has been really fun. I went to Arizona this last week, and anything that I wanted, I bought it because I can now. And that was really fun for me. So, yeah.
That's awesome. I love hearing those non-scale victories. That's probably one of my favorite things, is hearing those things. So the lagoon and being picked up by the muscle men, that's awesome.
It's been good.
Let me backtrack a little bit. With regards to the lipedema, you mentioned you've been treated for it, but as you mentioned, a lot of people don't really know what that is, and so they're not going to know what those treatments are either. Share with us kind of what those treatments entail and why it requires more than just weight loss to treat it.
Well, there are conservative treatments that people try, such as manual lymphatic drainage massage. The thing about lipedema is that your body is not processing lymphatic fluid properly, and it gets stuck. And so you have these heavy, heavy legs that are like full of lymphatic fluid. And the fat literally turns to scar tissue. And you can't diet or exercise scar tissue away. If I have a scar on my face, all the vegetables in the world aren't going to make it go away, right? So the conservative treatments are to try and get that fluid moving. People will do fascia blasters to kind of try and break up that scar tissue, vibration plates. It's all about getting the lymph system moving. Compression is so important, so people will wear compression garments. But really, in the end, it's like just putting a Band-Aid on it. It's really not doing much. All of those things are great for maintaining after you have surgical treatment. But for me, they weren't working. The treatment for it is actually liposuction. And I always feel like I have to qualify that because it sounds so cosmetic and so like, well, of course, you know, but that's really the only way they can get that diseased, scar tissued fat out of your body. And that is why weight loss also is so important ahead of time, because if they're going to go in and they're going to lipo, I want them to get as much of the diseased fat as possible. The regular fat I can take care of on my own. I can diet and exercise that away. Much easier now because I've, lost weight.
Right.
But the lipedema fat just won't budge. And so I could see some people not knowing that they have lipedema, getting weight loss surgery and feeling like it didn't work the way that they expected, maybe, where it actually did. And it is working, but you're not going to see the results you want to see if you have an underlying condition of lipedema.
Yeah, that's great advice. Some of the things that can help people understand if they have it or not is it tends to come in at the joints. So like ankles, some people can get in their arms, their wrists. And so you see kind of a transition at that point. And that's a good clue that they may be dealing with something more than just fat.
Yes. And you get a lot of cuffing at the knees and ankles. I actually did have it in my arms. I didn't realize I did. I thought I just needed to like work out more or something. I had choir arms. In Utah, we call them the Relief Society arms, where, they just swing, you put your hand up, you knock yourself out. Um, but my doctor said, no, he said, yeah, you could work out, but that fat's not going to go anywhere. So I was like, ah, so, so I was able to get treatment there also. And it's been good. And one thing I didn't know that the average person, when they get their blood pressure taken, it doesn't hurt them. My whole life, anytime I got my blood pressure taken, it was very painful. So I just thought every nurse I've ever had take my blood pressures just crank that thing down a little too tight or whatever. I did not realize that was something that people with lipedema experience. So
I'm curious, have you noticed a difference afterwards?
I have actually. I had to go. I just went in for like my yearly with my primary care, and I was like pleasantly surprised. So
That's awesome.
Yeah,
That's
been
awesome.
great.
I think our listeners would be interested to know about insurance and insurance coverage for this because, as you mentioned before, when you hear liposuction, most people think, oh, that's a cosmetic procedure.
Yes.
Tell us about that journey.
Okay. Well, first I'm going to back up and say part of the reason I didn't want to get weight loss surgery at first was because I didn't have high blood pressure. I didn't have diabetes. I didn't have anything that I thought the insurance would care. I thought, and they said, just based off your BMI, we'll pay for it. So that was great. So if anybody is questioning, just call your insurance and see, and then you might be surprised. With the lipedema, I called my insurance and they were like, the people I talked to didn't even know what I was talking about at first. And so I was like, I got to figure something out. So, I got my treatment through the Roxbury Institute in Salt Lake, and they have people that will help you through the whole process. So what they said was, you need to try all these conservative measures, which I had already tried. They said, send proof of all of these conservative measures. You've lost weight. We can prove that. And they said, go get a diagnosis. They could diagnose me there, but then they said, you need a second diagnosis. So I went actually to a dermatologist in Provo, and she did such a great job documenting everything, reaffirming everything I already knew. But to have a medical professional say that it's true was good. And so once they submitted all of that, I actually got my insurance to pay for it. I got approval in 10 days, which is unheard of. But I believe it was because I had done all this back leg work. And the thing about where I got my surgery done is that they will continue to appeal until it gets covered. So it is possible, but you have to do, the most important thing was that I had to lose the weight first. And that, I really think that's what made the difference, because how could they argue with me having it after I'd lost 100 pounds?
Yeah, no, that's fantastic. And I appreciate you kind of spelling out that complexity, because it is complex. And so just so listeners can understand, there are quite a few there are hoops to jump through to do bariatric surgery, weight loss surgery, but there's also a lot of hoops to jump through for the lipedema treatment.
Yes. And here's the thing, it's not easy. It sounds like, oh, liposuction, that, you just sucked it all out. Well, yeah, we did, but I'm going to be swollen for up to 2 years. I have to work out religiously to baby and heal my lymphatic system. And I mean, you could do 12 podcasts just on the importance of the lymphatic system, but it wasn't a quick fix. None of it is. Weight loss surgery isn't a quick fix. Lipedema treatment isn't a quick fix. It all requires work, but it's been worth it. And I had a friend who had weight loss surgery with you before I did, and she said, if you have weight loss surgery, I promise you that as you lose weight, every aspect of your life will be better. And I was like, okay, I was like, okay, but I get it now. And she was right. And for me, I needed, like, a lot was better after I had the weight loss surgery, but then taking it to the next level and treating my lipedema, that, like, now I'm like, okay, she's right. Every aspect of my life is better. Um, and I think I resisted that at first because I have, because I'm like, my weight doesn't define me. My worth isn't wrapped up in what I weigh. However, being able to ride rides at Lagoon with my kids, or being able to um, go hiking and not get winded with my kids, for me, that is worth something to me, to live a fuller life.
Yeah, absolutely. And I love that. And I love that perspective, because you're right. It's not about worth. It's not about that aspect of a person. It's really about health, and it's about activity, and being able to do the things you want to do. So I appreciate you pointing that out.
The other thing I want to point out about lipedema is that they're finding that they believe it's genetic. And so there's really nothing you can do to prevent getting it. And there's skinny people that have it. There's overweight people that have it. There's people that have it and it hasn't manifested yet. It usually comes out with major hormonal changes. All of my children are adopted, and so I can't imagine how it would have, like, manifested itself in my body had I had all of my children and had those hormonal changes. But it's a progressive disease. And so you really, if you have it, it is important to try and do something about it, because it's just going to get worse and worse, and it can take your mobility. And I've learned so much. This is terrible to admit, but I would kind of judge people sometimes. It would be riding around the grocery store and they're jazzy and they're overweight. And I would think, maybe if they walked, it would help them. But then I'm like, that person probably had lipedema and they can't, it's too hard. Their limbs are too heavy. They're swollen. And then I've learned a valuable lesson through this whole thing. But it is important to take control of your health. And then it also doesn't matter if people say it was the easy way out, or you're so lucky you had liposuction, or you're so lucky you had weight loss surgery. I'm blessed that I was able to do those things and get the treatment. And I hope that everybody else can find a way to be as lucky and blessed as I have been.
That's awesome. I love it. Let me ask you, back in deciding on the procedure, you said you came in, you're interested in a sleeve. Sophia went through the different options with you, and you gravitated towards the CDS. Help us understand a little bit, for you, why that was important.
She said that research is showing that you can have longer, like people are keeping the weight off longer, and a little, I don't know if I like the word easy. I don't like that word. A little easier with it, because it is kind of hitting it from two different sides. I was a little worried about rerouting my insides. Because once you reroute them, I don't think you can undo it. So I was concerned with that a little, but anytime you have surgery, it's a concern for anything. But in the end, I was like, I want to have the best results possible and the best chance at success, long-term lifetime success. And so that's why I went with it. But I really think with any of the surgeries, you're going to be successful if you do what you're told and you change your habits and you work on your emotional self, because a lot of us are overweight because of emotional things that we haven't dealt with. So there's a lot of work to be done just through the whole process and forevermore. So, but I wanted that extra help with this.
I love that. And you've hit on a couple of very important points. One is kind of the total aspect of treatment, and the mental, psychological aspects that are very, very important. And having friends who have been through it, talking with people, other patient support groups, all of those are ways to help kind of work through that aspect of it. And I also love that you emphasized that, um, these tools, they have advantages, disadvantages to each one. And when I sit down with patients, we go through that, and for some individuals, a SADS is that, they feel the right thing. For other individuals, it's a sleeve. Um, in full disclosure, SADS hasn't been around that long. And
Right.
so some of the, it's going to be better long term. Some of those are assumptions. Some of those are, what we think and what we anticipate. But it's giving patients with any of these operations, giving patients a tool that allows all those things they've done before, the diet, the exercise, the work they've put in before, actually now makes a difference because of that new anatomy and that new tool.
Yes, and really that was another thing though with the Sadies is that I was like, oh, it's only been around for like 30 years or something like that. So
Not
that
quite
was
that long, but all right.
okay. 20. I think 20. I was being generous. And so then I was like, but then I calculated the risk and I was like, we're doing it. So, but it might not be for everyone. And some people want a little bit more data, a little bit more research, and a little bit more time.
And maybe to add a little bit of clarity, just so the listeners don't get too confused, CDS has actually been around less time than that. And when I talk about been around, it's that we have, you have to have enough people that have had the operation and then follow them out long term. It's only been approved as from the ASMBS, which is the American Society of Metabolic and Bariatric Surgery, for about the last 5 years that it's been considered a mainstream procedure and been endorsed by that group. And so that required about 5 to 10 years of research prior to that, with actually small numbers of patients, so not a ton of patients, but it looked good as an option, and so then it was endorsed by the ASMBS. It's a modification of an older operation called the duodenal switch. And that one has been around much longer. And the modification decreases the risk somewhat. If you look at all of our operations, I would say the duodenal switch is probably our most risky operation. And the SADS decreases that risk somewhat, still with some very good results. Maybe not quite as significant as a DS, a duodenal switch, but probably better in a weight loss standpoint than a bypass, and some diabetes resolution a little bit better. And so with these more aggressive operations, we really hit hard and discuss them a lot with patients who are very, very overweight, BMIs 50, 60 and above, because they do have those double mechanisms, the restrictions and the malabsorption. But then we're finding that because it is a lower risk than the DS, that individuals who maybe aren't quite as heavy still can benefit from it and get through the procedure very safely and do very well.
Mm-hmm. Something interesting, a little side note, is that through this whole process of my weight loss surgery, we discovered that I had a huge lipoma in my abdomen that we did not know about. And so that we discovered anyway. I had that surgery about 6 weeks after I had my weight loss surgery to get that lipoma removed. I had to push Dr. Pierce just a little bit because he said, maybe we should wait a little longer to take it out. And I said, we have to do it before the end of the year. So he's like, okay, we'll do it the 31st of December. And so the 31st of December, 2024, he was also able to take out that lipoma. But so I guess my point is that like having weight loss surgery and having all that goes into like the health checks before you can have it has like helped me in more ways than one. Getting that removed. And I appreciate that, just all the checks. Like I had a colonoscopy before, I had an endoscopy before, and it kind of also gave me peace of mind that I am healthy, that It just, the whole process has been so great. Now, the prep before wasn't necessarily my favorite, but
The liquid diet you're referring to.
yes, well, and I did the meals,
Mm-hmm.
which helped. I did the liquid and then the meals that I got from the office. I can't remember what they're called. Um,
HMR.
but I'm like, if I can do that, I can do anything. I'm like, I need to go on one of those TV shows where they strand you in the wilderness with no food. And I'm like, I could do it. I could do it.
I love it. That's awesome.
I've done it.
That's awesome. Well, you've shared a ton of things with us, which has been very helpful, and I've loved it. Anything else that we should know about you or about your journey that you feel would be helpful to others?
Just that you have to let go of the shame. There is so much shame in our society and the way that we live and do things, around weight, so much judgment, and we have to let that go. We have to let that go if we're the ones feeling it, and we've got to let it go if we're the ones giving it. Our value is not wrapped up in what our bodies look like. There is such a thing, I think, as skinny privilege. People treat you different when you're thinner, and that's not right. Um, and so I think we just need to do better as a society, at being kinder and gentler and supporting people, where they're at, and realizing that there might be something underlying, like me judging people in the Jazzy at the grocery store. That was wrong. There could have been something, some underlying thing that I didn't know about. And so I think we need to, as the patients, give ourselves grace. And when you're trying so hard and you make a mistake, or have a bad meal, it's really easy to spiral and think, I can't do this. I'm resigned to be overweight my whole life. And that's not true. You can do it. And find the people that support you and surround yourself with those people. And don't be afraid to ask the questions and take the leap. Call your insurance company and see what they have to offer. Even if you just started with a nutritionist. But if you feel like it wouldn't hurt anything to go have a consult for weight loss surgery either. It doesn't mean you have to do it, but it is a step in the right direction, and it gives you so much momentum. So losing the weight I lost from weight loss surgery has given me momentum to do other things. And it's been such a blessing. So we just need to love each other more, and including ourselves. Like, let that shame and judgment go.
I love it. What a great message. Laura, thank you very much. Thank you for taking your time. Thank you for sharing your story. It's been a great morning. Thank you.
Awesome. Thank you so much. I appreciate it.
Thanks again to Laura Palmer. What a wonderful story. I really love her emphasis on how we need to have grace for ourselves and for others, be less judgmental when it comes to weight issues, recognize there are a variety of situations, and just help out where we can. I also really enjoyed seeing her light up when she talked about all of the non-scale victories, being able to ride the amusement park rides and buying clothes off the rack. Just so many wonderful changes in her life.
Resonate.